Hi, I'm Dr. Randy Martin and I'm a cardiologist. So I thought it would be interesting if I could actually teach you a little bit about the heart. Now it has four chambers, two atrial or receiving chambers which sit on the top part of your heart, and two muscular or pumping chambers called ventricles which sit on the bottom part of your heart. Your heart also has four valves, and these are delicate tissue-like structures which are designed to act as a system of one-way doors, ensuring that the blood flows in one direction through the various chambers of your heart. The oxygen-rich blood then returns through a series of veins into the left atrium. Now, sitting between the left atrium and the left ventricle is a delicate valve called the mitral valve. And when the mitral valve opens, the oxygen-rich blood in the left atrium fills the left ventricle, and then as the left ventricle contracts to send the blood to the body, the mitral valve shuts tight. Now, if a valve does not shut tight, it produces a condition called regurgitation. Mitral regurgitation is the most prevalent significant valvular condition today. So to understand it, let's actually go into your heart and take a close look at the mitral valve, or what we refer to as the mitral apparatus. If you stand in your left atrium, you're looking right at the mitral valve. You'll notice that it has a front or anterior leaflet and a back or posterior leaflet. Now when they're closed, the two leaflets meet, creating a perfect smile. One of the most common abnormalities of the mitral valve that leads to mitral regurgitation is called degenerative mitral valve disease. This is a condition where one has abnormalities of the tissue of the leaflets themselves and the fine chordae. The chordae tendineae themselves may actually rupture, and then that portion of the mitral valve actually prolapses or falls back into the left atrium, leaving a large gap as the valve closes, which causes the development of mitral regurgitation. During mitral valve repair of a degenerative portion of the posterior mitral leaflet, the surgeon might actually excise or remove the weakened portion of the posterior leaflet, as well as the abnormal chordae, by doing a small triangular resection and then suturing the valve back together. A well-repaired mitral valve prevents mitral regurgitation and again allows the mitral valve to function as it should normally.